the 400 plus number in our 10 county area of suicides, a lot of those could have been prevented. And so I want to encourage you, whatever it is, whether big or small, it doesn't matter. Reach out to Pawnee Mental Health and reach out to explain to them what's going on and what that is, because they promise you that it sounds like they will have an opportunity for you to get some help and to go work through that stuff, whatever it is. You don't have to do this alone. What's going on, everybody? Kyle Powers here, Haven Real Estate Group at eXp Realty, here with another episode of Local Legends of the Flint Hills, where business meets community. You guys, today I have Mike Riscala here with Pawnee Mental Health. Mike, thank you so much for joining me today.
Thank you for inviting me.
Yeah, absolutely. Had a small mix-up on it here, but I love that you're still willing to jump on camera with me. But so, Mike, I'm excited to kind of do this one today, just to kind of, because it's such a hot button anymore with the mental health status of the mental health in our community and just in general our country. But before we kind of dive into what we're going to talk about today, I want you to kind of give us a brief history of what Pawnee Mental Health has been and has meant to this community for so long.
Absolutely. And thank you for this opportunity, Kyle. So Pawnee Mental Health is a safety net provider community mental health center. Was established in 1956 as the mental health center for Riley County. And then throughout the years, other counties joined and it became a mental health center that provides services across a 10-county area. The Riley County part is usually, because of the high density of population, where you find a lot of the offices and services that we provide. Again, we're spread throughout a 10-county area. Mm-hmm. And over the course of the years, the name Pawnee Mental Health evolved. It started as Riley County Mental Health Center, and then it became Sunflower Guidance Center. And throughout the course of the years, up until 1982, when the name became Pawnee Mental Health Services, we provide services to about 6,500 individuals. Wow. Throughout the 10-county area.
It's amazing.
We are a safety net provider, which means anyone coming to us, regardless of their ability to pay, will receive services. We are available 24/7 throughout our 10-county area through our crisis services. Mm-hmm. So if someone is in an acute mental health crisis, they can call us day or night, and we are available. Again, the whole mission of Pawnee evolves around providing compassionate care, access to care, and being part of the community and focusing on our community.
That's amazing.
Yeah.
That's amazing. So you're servicing 6,500 individuals, and then you have, I guess, by safety net care, right? You are talking about everything there, but I guess that's kind of want to dive into a little bit more. What services specifically that you are able to provide here?
Absolutely. So Pawnee has 5 pillars of services. I call them pillars.
Yeah.
So we have therapy services, and therapy is the outpatient mental health services that we provide in office via telehealth or in the schools. We have partnerships with multiple school districts in the area, so we provide school-based services as well, and part of our mental health services outpatient model. We also have medical psychiatry and medical, we call it medical services. This is a second pillar. Mm-hmm. So if someone is deemed after being assessed to be in need of a prescription and seeing a provider to help them regulate their medical needs in terms of mental health, that is the medical services side that we provide as well. We also have, this is the third pillar, we have crisis services, and I would say that crisis services is divided into like 3 pillars, but mainly we have outpatient crisis services, and anyone who needs access to crisis, they can call us and they get in. They get through rather to our crisis line. We also have mobile crisis response. This is another component we added in 2024, March of 2024, and we have expanded that component so we can meet the individuals in the community at their own environment. They define the type of crisis, the mental health crisis they have, and we go provide the service to them. This alleviates the burden on instead of them going to a hospital, ER, or calling 911, they can call us and we provide the service. So this is again under crisis services, and we still have the crisis stabilization unit at 1558 Hayes Drive in Manhattan. And crisis services has been a pivotal point in the services that we provide because of the lack of inpatient hospital beds here. It is not a hospital level of care. It is considered an outpatient level of care, but it is a critical need here. And when paired with mobile crisis response, when paired with the outpatient crisis side, it forms a strong crisis response component to the needs of the clients. We also have recovery services, and recovery services, this is a fourth pillar, and that is provided through individual therapy or group therapy, and continues to be a significant component of the work that we do. And we also have the community services component, and that is the wraparound case management, social determinants of health that our adult and youth community services folks, staff, and team respond to and provide to the clients that receive all the other services. So it's a very robust model that is provided under the what is called certified community behavioral health clinic model, which is a designation that we have attained in 2023, and we continue to grow in this designation and the scope of services provided. These are the 5 main pillars, but we also have smaller programs provided under those. So for example, ag assistance, agriculture assistance. Let's say someone who's a farmer or a rancher, their family members themselves and folks who work for them can receive services from us under the Ag Assistance Program and can benefit from these services, 3 free visits at no cost to them. This is a very unique program that is not provided anywhere else in the state. Pawnee is a unique provider for this. When we became a certified community behavioral health clinic, we have also started providing other programs or integrating other programs and other services. So we added assertive community treatment, and that is high intensity program for individuals that could be having increased needs, so they don't end up being hospitalized. And we have expanded a multitude of other services, but again, the 5 main pillars are the ones I have mentioned.
So, Mike, with everything happening nationally, I know that there's been a lot of changes that have happened, with probably a lot of it due to COVID and things that way, and kind of the dynamic of our country has changed just a little bit. So I want to give you an opportunity to talk a little bit about that, and specifically about what is happening nationally with mental health.
Yeah, and thank you for this question. Mental health has become a pivotal point of need and an area that had and continues to attract a lot of attention because it is a growing problem, and a growing area of need. So we have been seeing a surging demand and a huge need for care. I'll give you some data that I have put together.
Sure.
And
Please.
so while public awareness has reduced stigma and boosted care seeking, over 47% of the U.S. population lives in workforce shortage areas, meaning it's hard to hire. It's for the mental health profession. Mm-hmm. It's a lot harder. And let me give you a story. I met someone recently, and I said, the person introduced themselves and told me what they do and that they are in private practice. Private practice is slightly different from what we do, and I said, well, hey, why don't you give us a shot and see if you would like working for us and come join Pawnee. And the person said, you work with high intensity clients, and it could be a little much for me. And we do work with folks at different levels of the care and different ends of the spectrum, whether it's high intensity or low intensity. But even though we know the statistics and we know what is happening, it was an eye-opening experience for me when someone says, well, you work with high intensity. Yeah. So it is high intensity. So there has been a growing crisis, demand for crisis services, and growing crisis in mental health. So roughly 1 in 4 individuals, for adults in the U.S. experience a mental illness annually.
Wow.
So that's a high area of need. Youth mental health is in a declared national emergency with rising rates of depression, suicide, and self-harm. Like I said, severe workforce shortage. Nearly 50% of the U.S. population lives in a designated mental health professional shortage area. Yeah. Other things that we're seeing, that stigma continues to be an area, but it has reduced. Things have changed, that you no longer need to hide mental illness, that there's care available, there's access to care available, and you can seek help. So it is not stigmatized anymore. Focusing on prevention and equity, there's a growing push towards public health approaches, focusing on social determinants like access. When you think about the services that Pawnee provides, and when you think about, for example, about community services for youth and adults, the wraparound services that would help an individual understand what supports are available to them and tap into these supports leads to better health outcomes. So it's not just the therapy that they receive or the prescription through a provider that they receive, but also knowing that there is a case manager that can help them get a prescription refill, go to a court appointment with them, help them manage the symptoms and advocate for them. So these are the national trends that we have been seeing. I would also like to talk a little bit about the Mental Health America. Mental Health America is a national advocacy and research organization. Every year they release a report on mental health. The ranking by state is included in that report. State of Kansas in 2022 in the Mental Health America report was ranked 51. And it took about a year for the community to realize that there's such a statistic and there's such a ranking, and what do we need to do about this? Mm-hmm. And around that time, the Certified Community Behavioral Health Clinic model was becoming a model that the state has adopted for the community mental health centers. The 25 community mental health centers across the state became certified community behavioral health clinics between 2023 and 2022 and 2025. All of them are certified community behavioral health clinics, including Pawnee Mental Health. And so I would credit the CCBHC model for improving the ranking for the state overall, because even though we were ranked 51 in 2022. The ranking has changed in 2024. The state of Kansas has become 22 in the ranking, so that is 29 ranks up. In 2025, the state of Kansas became 18. So kudos to all the folks who work in the mental health profession, to the folks who work in the certified community behavioral health clinics. Things have improved for the state overall ranking. And I would also give a shout out to all the certified community behavioral health clinics, to our colleagues at the Kansas Department of Aging and Disability Services, to the Association of Community Mental Health Centers of Kansas. All of these have been critical players that have helped advocate for services and improving access to care. Of course, not to forget all the staff who work at these community mental health centers, which are also called certified community behavioral health clinics. Here are some good data.
Yeah.
The prevalence of mental health concerns among adults in the U.S. has not changed significantly from 2021 to 2024, but in 2024, 23% of adults in the U.S. experienced a mental health illness in the past year, equivalent to about 60 million people in the U.S.
Wow.
So that is a huge number. And another way to simplify, one person in each household, I would say one person in each household. So when you read that one in each 4 adults, that's another way of looking at it.
Yeah.
One person in each household. 17.7, almost 18% of adults in the U.S. had a substance use disorder in the past year, totaling over 46 million people. That is all in 2024.
Wow.
5.5% of adults reported experiencing serious thoughts of suicide, totaling over 14 million people. One important thing to point out that in 2022, suicide was the highest cause of death in the U.S. One of the highest causes of death. I take this back. One of the leading causes of death. 49,000 lives lost to suicide in 2022. That is about a life lost to suicide every 11 minutes. So that's a very high number.
Staggering.
It is very staggering. On the other hand, so we've heard about this, these statistics. Young people are struggling in 2024. That is 11% of youth ages 12 to 17 in the U.S. experienced a major depressive episode with severe impairment in the last year. So that is about 3 million youth ages 12 to 17 reported frequent thoughts of suicide. So this is a major crisis, I would call.
Do you know, what are your thoughts on what the cause of some of that is? Do you have stuff that you can say on that?
For mental health?
For that age group from 12 to 17, having that, because that's scary and that's a staggering number. I mean, the fact that that's happening out there.
I would say one of the areas of need continues to be for youth is the need the need for crisis services. Having access to crisis services is a critical area of need. A lot of it too has to do with access to care in the schools. We have been at the forefront of providing services in the school system. A lot of this has to do with access to care.
Yeah, that's crazy. So I guess my next question for you, so those are the national stats. What are you guys doing locally trying to be available for either that age group or even adults and things there? What are you guys doing? I know that we're going to talk about, and this is actually when I want to talk about kind of New Day Pawnee and kind of dive into that a little bit about what you guys are changing and doing and getting ready to help.
Absolutely. So here's what I would say. We have programs spanning the different age groups, including youth. So when you think about outpatient mental health that is available throughout our 10-county area, medical services, crisis services, when we go out to attend to a crisis that is happening in the community that is reported by a client or someone on their behalf, that has prompted our mobile crisis response team to go out, that is an area where we don't distinguish between whether the individual is an adult or a youth. We provide the service, the care to them, and providing them with access to care regardless. Right. When you think about services that are provided at the different school districts that we partner with 9 school districts, and we are exploring opportunities for partnership with other school districts this coming school year, and we're very excited about this. 2 more school districts that will start tapping into therapy services. And when we provide services at the schools, we provide not just the therapy services, but also make our services available to the parents of the child through case management, wraparound services, and any other services needed as well. So yes, a lot of access is available through our services to the children, to their families, and we're happy to partner with the school districts for this service.
That's amazing. And that is doing with so I guess a little bit more on New Day. That's kind of the movement with that moving forward is kind of the deal there.
Sure. So we started looking into ways of promoting and celebrating the good work that we do. Pawnee turned 69 in November of 2025. Pawnee will turn 70 in November of 2026. And New Day at Pawnee is a way of celebrating the good work, promoting the work that we have evolved and grown and expanded within Pawnee. And my message to folks is, if you think that you know Pawnee, think twice, because we have grown, we have evolved over the course of the years. We're no longer the same exact small agency. We have grown significantly. We have a large team, and we have a large area to serve. Yeah. We have a 10-county area to serve. So it's a year-long celebration of the good work that we do, promoting the work that we do. We have some things happening in this year, and also in the future. We continue to celebrate mental health happenings and promote the work that we do. But a New Day at Pawnee is another way of not just celebrating the good work that we have achieved over the course of the 69 past years, but also for 69 more years to come, and continue to promote that good work.
So, Mike, you were telling me off camera here, you were telling me a little bit about that May coming up as we're recording this is right around the corner, but May being Mental Health Awareness Month. And then you dove into a little bit about the numbers of the suicide rates in our area. So I'd love to hear a little bit more about what you have to say about that in particular. And then I really would really like to have somebody give us, anybody watching this, give them an opportunity to reach out to you. You know, what does that look like? Is it the hotline? Is it online? What does that look like?
So for Kansas Department of Health and the Environment has produced some data for the period between 2011 and 2004 in 24, and that is 414 lives lost to suicide in our 10-county area. Riley County had 113 lives lost to suicide. And I would say my message is for families, for individuals who are struggling with mental illness, if you need access to care, come any time during the day, or actually it's during the day between 8 a.m. to 3:30 p.m. For our same-day access at 1558 Hayes Drive, or you can also walk into crisis services and ask for a screen or to see someone. They can also call our crisis number, 1-800-609-2002, 1-800-609-2002, and they will get help immediately. So, reminding folks of the importance of accessing care, seeking care, and talking to someone. That's what it takes. Talk to someone and seek help.
Yeah. And I think that's something that you see so much right now with the stigma that mental health care has around it right now, is that people don't like to do it. But I think it's an incredibly important piece to be able to kind of unwind a little bit about what's going on, because there's a lot going on in a lot of minds today, and I think that a lot of things out there, it's hard to delineate between everything. So I love that you guys are here to help on that end of it. So and I know that you also want to talk about your Grow Green Match Day and talk a little bit about that.
Yeah, I would like to give a big shout out to all of our donors, Greater Manhattan Community Foundation, and all the matching donors for their help and generosity. For the donors, Pawnee's Friends, we have generated over $30,000 in Grow Green Match Day during Grow Green Match Day. The funds will go towards promoting art in the programs that we have within Pawnee. And this is a game changer. There has been a growing need and a growing passion in our community for art. And so this brings me to celebrating the month of May as Mental Health Awareness Month. And I would like to ask your viewers and listeners to save the date for what we call More Good Days, which is a community art show, and that is in recognition of Mental Health Month. That we will be hosting More Good Days, which is a community art show. It highlights connection between creativity and mental wellness. There will actually be 3 art shows, and I would like to give the dates
Please.
And locations for these art shows. And we're doing this in collaboration with other community mental health providers and promoting the good work that they do and inviting their own clients to participate and also join us during these 3 separate art shows, whichever one that is closer to them. We will have one in Junction City, and that will be on Thursday, May 7th. And Tuesday, May 7th to May 26th, there will be a reception on Thursday, May 7th, 4 p.m. to 6:30 p.m. And the location for that is the Dorothy Bramlage Public Library in Junction City, 230 West 7th Street in Junction City, in Concordia, on Thursday, May 14 to Thursday, May 28th. So this is a continuous period, and the date for that will be, for the reception, there will be a reception on Thursday, May 14th, 5 p.m. to 8 p.m., and the location for that will be Cloud County Community College Welcome Center, and the address for that is 221 Campus Drive, Concordia. For Manhattan, there will be, this is a little loaded with dates, but it will be Thursday, May 21st to Thursday, June 4th. There will be a reception on Thursday, May 21st, 2026, between 5 to 8 p.m. And that will be at our Midtown office here on this campus, located at 116 South 4th Street, Suite A. There will be additional artwork displays that will be located at Tropical Snow at 110 South 4th Street, and Therapy and Hungry Chickpea at 106 4th Street. So as you can see, there's a lot of events, and we're doing this to celebrate the Mental Health Month of May.
Yeah. No, and I love that. And I think, and it's showing too how you're getting the community involved and everything too. And I love that for us. So, before we kind of wrap this video up, is there anything else you want to add to it?
What I would like to say is Pawnee has been part of this community for 69, almost 70 years. If anyone has need for care, try Pawnee Mental Health. There is a big number of programs available to respond to whatever care and address to whatever type of care or need there is. We have been part of this community. We are for this community and here to provide the care. Every year we serve 6,500 people. If you think you need care, please call us or visit us at any of our locations. We serve a 10-county area, and this has been a big area of need. Mental health has been, and we are humbled to be part of this community and continue to serve the community over the course of the past 7 years.
Yeah, that's amazing. And I guess I want to give you one more chance real quick. I know you've got the hotline number right there, but to give the crisis hotline number just in case anybody watching this needs to reach out.
The crisis hotline number is 1-800-609-2002. 1-800-609-2002.
Yeah. And kind of at that moment, first off, I want to say thank you so much for joining me today. I really do appreciate it. And I want to encourage you guys that are watching to this point, I want you to encourage you to reach out, right? You've heard him. There's 6,500 people that they're helping in this 10-county area. Just in Manhattan, they've got 7 locations that they have that they can help you. And so if you need to, or if you're like, you know what, maybe I should, reach out. Always lean on the piece of reaching out. Because what I can tell you is that 113 number, the 400 plus number in our 10-county area of suicides, a lot of those could have been prevented. And so I want to encourage you, whatever it is, whether big or small, it doesn't matter. Reach out to them, reach out to Pawnee Mental Health, and reach out to explain to them what's going on and what that is, because they promise you that it sounds like they will have an opportunity for you to get some help and to go work through that stuff, whatever it is. You don't have to do this alone. I want you to come in and see Mike and his crews and the 7 different locations in Manhattan or anywhere in the 10 counties in the area. So please reach out. Do not hesitate. If you are needing this, and if you have somebody who might be thinking about it, please share this video with them, right? They can see a little bit about who Mike is, and they can see a little bit about what his team's able to bring to the table. And I want to make sure that you guys are getting the help that's needed, and I want to make sure that you are having that. This coming month of May is going to be your May Mental Health Awareness Month. So please make sure that you are giving this opportunity to somebody that may or may not need it. This is a good introduction to what they're able to do and what you're able to see and what they can do to help you. And again, reach out. Just make that phone call. Reach out on that crisis hotline. Reach out on the website. Whatever that mode of getting a hold of Mike and his crew, please do so. But again, Mike, I want to say thank you so much for joining me today. I really do appreciate it. And you guys, thank you so much for watching. As always, if you have something, if you want to share this video with somebody, please do so. And then also, if you enjoy this content and you enjoy these local legends that we go through here, please go ahead and hit that subscribe button. Go ahead and hit that little bell so you're notified of any future content that we've got coming up. And again, as always, thank you so much for watching this video. I really do appreciate it. And let me know if you guys have any questions or need anything from us. But thank you. We'll see you next time.